Okay, another high-profile incident recently uncovered. There was a doctor who worked primarily for over 30 years for USA Gymnastics. He's going on trial presently for molesting a family friend, which is like a young child that maybe your friend's kids, your neighbor's kids, your godchildren, someone close to the family, and possession of child pornography. Now, I know absolutely, sorry about that, chair squeaking. I know absolutely nothing about that case one way or another. It's already in the hands of that district attorney. But he has recently been accused of molesting children while working for the gymnastics program. 3 women came forward recently. All these women claim molestation as younger girls. And there have been reports that there may be as many as 60 girls. 60 girls have already come forward and made some complaint one way or another. And I've heard guesstimates that maybe over 100 girls in the total run. Now, a lot of sports teams, very powerful sports teams, and the Yankees, the Cowboys, things like, the Bulls, major sports franchises, have a specific team doctor who is almost always an orthopedic surgeon. And he'll be the doctor that the team is supposed to go to if they have an injury on the field or whatever the hell, blah, blah, blah. Sometimes, I don't know specifically, but sometimes you may have a team that is so wealthy and they need medical services so desperately that they may literally have a doctor's office set up on site, and they may have their own private doctor whose sole job is looking after the team. Okay? Now, USA Gymnastics is not a team so much as it is a governing body of the sport. And the heads of US Gymnastics for many, many years were Bella and Marta Karolyi. Bella and Marta Karolyi were Romanian coaches. Their most famous people over there was Nadia Comaneci. They defected during the Cold War, and because they were such great coaches, they were immediately taken in by American gymnastics, and they rose so fast to the top, it was unbelievable. Okay, they were the head coordinators for gymnastics. Now, they had several prominent athletes of their own. Carrie Strug, Dominique Moceanu, Mary Lou Retton, Kim Zemeskel, to name a few. But what their main goal as coordinators was to build gymnastics teams. Now, what they would do is they would have, and things have changed over the course of years, how they do certain things will have changed here and there. But the basic gist of the story is gymnastics coaches from all over the country would come to Bella and Marta with their athlete. And they already were well established in their own right. The athletes were already well established in their own right, and they would bring their athlete to the Karolyis for screening. And it would be because of a myriad of tests, trials, and the Karolyis would build Olympic teams, world teams, national teams. In fact, Dominique Moceanu herself in 2007 said that unless the Karolyis say so, you're not going to the Olympics. That's how powerful they were. They built the teams. They always had a say in what went on. In fact, the Final Five, they call themselves the Final Five for 2 reasons. Number one, in 2020, the team will be devolved to 4 people, not 5. So it's the Final Five. But also, they were Marta's final pick before retirement last year. Okay, and they would have the gymnasts come in, and these already had to be elite gymnasts. They already had to have a resume, and they would just do whatever the Karolyis want them to do to test out for the team. From a strictly professional standpoint, The Karolis are the greatest coaches in the sports history, period, no questions asked. World history. Okay? They are the Vince Lombardi of gymnastics, okay? They are the best. On a more personal level, they're not always nice people. It's not beneath them to yell at their athletes, and yell as in Bella's over 6 feet tall, and some of the girls would be 2 feet shorter than he is. Okay, they would jump up and down like 5-year-olds if they had a perfect routine on hands, but if one slip up was made, they would go ballistic. Okay, so on a personal level, they're not that nice, to say the least. But in the sports world, the powers that be, they want to win. Okay, and I actually told Ani Mochiano several times, and I believe I'm right. And she's obviously not going to dispute me on it because she knows it personally. The powers that be did not care what the coaches did between point A and point B, so long as the gymnast was on the podium. The powers that be wanted the gymnast to get on the podium, period, end of story. It didn't matter what they had to do to get him there. Yelling didn't matter, okay, extreme training didn't matter, and in some cases, physical abuse might not have mattered. Now, USA Gymnastics had a coach, a doctor, Dr. Nasser. In fact, here's how powerful he is. This article was in a bin for over 20 years, and I took it out, and I'm going to have it framed if I can. And then this story broke out. That's him. That's the guy in question. That's Kerry Strug. That's Marta Karolyi. And Bella's head is over here in the corner. He was literally on the floor the night the Magnificent Seven won. And when Kerry Strug shattered her ankle, he was literally the first doctor to reach her. Okay? That's how powerful this individual was. He was the official doctor of the sport, and they went to him for everything from broken toe to anything. If there was a medical problem involving the girls, they went to him. I don't know how much they do with the boys. I don't know about that. Men's gymnastics is under the same umbrella, but they have a different governing body. The Karolis almost never work with men. They almost always work with women. That's just the way it is. I mean, it's just, you have men coaching women, you have women coaching men. It's just, that's just the way it is. Now, this individual had offices on site at the Karolis ranch. Now, the Karolis had a giant, they still do, have a giant ranch in Texas. They have a personal home on the ranch. They have a farm they have like a petting zoo on the ranch. They have all these animals on the ranch, and when the girls get a little bit of brief time, they go and they play with the animals. Whenever they do get a brief time, very, very seldom they do. They have a bungalow system. They have like little bungalows for the girls and coaches and other people in question to stay while visiting the ranch. And they have a full-fledged, fully functioning gymnasium there, which has everything you want for a gymnastic. You could literally have a full-fledged gymnastic tournament at the ranch. They use the ranch for training. They use the ranch for selecting the teams. The girls, and believe me, there's a lot of girls that have gone there. In fact, if a girl has not been to the ranch, she's probably not an elite. Okay? That's how many girls go there. They go from all over the country to this ranch. The Karolis screen them, the Karolis test them, the Karolis are always trying to build up the next team. In fact, the ranch is so powerful that with the Karolis' retirements, officially, Bella retired several years ago. Marta took over after Bella entirely, and she officially retired at the close of the 2016 games. That was her official retirement. But Nastia Lukin's father has officially been named as Marta's replacement. He will take over for the 2020 games and other major events. But he will literally, unless things change between now and whenever, he, as it stands now, will literally be going to the Karolis ranch. The Karolis will have no power. They will not have any say in what his name is Valerie does, but they will literally have the keys to the gym at the ranch for him. That means he will literally have to come to the ranch with the kids and train with them at the Karolis ranch. In fact, I've even heard rumors that the Carollis may be charging money to the gymnastics program to rent their facility. Okay, they're very powerful. Now, this individual doctor was at their ranch on a billion occasions. Okay, he saw every girl that went there. Mochiano came out publicly the other day to say, she said this on her official page, okay? She said she was not molested by him. She obviously knew him because he was on the floor with her a couple times, but she was not molested by him. Because that's what she said. So, yeah. And he had facilities at the ranch, his own private office, private exam rooms. And a couple of times, a couple of girls said he would go to the bungalow and meet with the girl in the private bungalow, which is not exactly appropriate. I understand firemen and paramedics have to come into your bedroom when they're responding to an emergency. Some doctors, every once in a distant blue moon, will entertain house calls, not very much anymore. But typically you meet the doctor in the living room, the dining room, the kitchen, not the bedroom. So that's a little on the inappropriate side. If he has an office right there and he's going into the bungalow, into the bed to meet with the girl, it's a little on the inappropriate side. Unless she physically couldn't get out of the bed, then it will be okay. But he was alleged to have given the girls a back treatment because they have back problems. They do. And it is alleged he would take his bare hands and massage the inside of the vagina to alleviate their back cramps. Now, I'm going to put links below to videos that were shared by the Canalises, Dr. and Mrs., and you can look yourself. One of the journalists said in the video, and I was shocked myself. Ready? There is a legitimate medical treatment that involves alleviating back pain by massaging the vagina. I didn't believe it either. What? But that treatment usually involves wearing a glove instead of a bare hand, doy, and it usually involves a parent being in the room with an underage child. Now, to put that into perspective, I have heard of every back treatment, okay? I have heard of massages. I've heard of medication from Flintstones vitamins to prescription medication. I've heard of injections. I've heard of heating pads, ice pads. I've heard of electroshocks. They have this special sports medicine thing where they put electrodes on your body and they shock the muscles into repairing themselves. I've even heard of professional massage therapists taking off their shoes and socks and standing on people. This is a professional therapist, not a girl with her sister. Okay? But I have never heard of an adult male doctor massaging a vagina to alleviate back tension. In fact, me personally, if I were a doctor and I had a patient with a back issue, that would literally be the last thing on my mind. Literally. I would literally go through every routine before I got to that one. Okay? Literally. Because that is such an open door for a problem. It's not even close to funny. Even if you whip out a medical textbook and show the parents this is a legitimate medical procedure or treatment, it just doesn't jive well. Okay? Especially for a child. Okay? Of all the things you can do to the back, you're going to massage the back of the vagina to alleviate back cramps. I personally would never do that as a doctor. And I would highly recommend that patients ask for a different treatment. Now, it is alleged that he did this many times for many girls over the course of a 30-year career, and some girls may have been as young as 9 at the time. Now, that sounds pretty funny to me, that you're going to have to treat dozens upon dozens of girls for back problems, and your go-to treatment is always a vagina massage. Okay, I'm getting red flags, the sirens going off my head right now with this one, okay? I mean, I can't believe it. Now, I've heard of gyms that have their own people on staff. you may have a gymnasium, and I've seen they have a therapist, a physical therapist, massage therapist, acupuncturist. Okay, sometimes you may get a person that has multiple skills, massage, acupuncture, and physical therapy together. They almost always go with women, because if you're gonna have a 9 or 10-year-old girl and you're gonna give her a massage, from a mature standpoint, it is always more comfortable for the girl and for the parents and for any potential problems down the road if a woman is doing it. They have women that are between maybe 25 and 35, and they're usually the ones they hire. They might give the girl a massage on top of the clothing in front of everyone, just to shoulder massage. Or they might have to go into the exam room and do practically a regular massage where you strip down, wrap a towel around your waist, and lay down on a table and get massaged. And it's me personally having nieces, having a niece who was one step shy of a professional athlete herself. My niece is a field hockey player. She's an adult though now. I personally would feel much better knowing that my niece or my daughter or my cousin or whatever was being massaged by a woman as opposed to a man. Especially if the massage involved being undressed privately behind a closed door. Okay, that's just the thing they do. They hire a woman specifically for that because they don't want the appearance of impropriety later. Women can molest girls, women can molest boys, but 99% of the time it is far more likely that it will be a male perpetrator. That's just the way it is, mathematical fact. Okay? And I personally would deviate back problems to the masseuse. If I was a doctor and I had a 9-year-old girl come in and say, "Doc, my back hurts," I would say, "Okay, honey, your coach has a masseuse on staff?" "Yes, Diane," whatever her name is. Okay. Tell Diane to give you a massage and come back later. If that doesn't work, then I'll do something. Okay. But I would probably prefer the therapist be giving the girls the massages, be touching the girls. Okay. Acupuncture, physical therapy. Okay. That just is so much more appropriate. Okay, broken bones, doctor. Head injury, doctor. Okay, back injury, doctor. Okay, but if it's just simple tension, simple muscle problems, go to the masseuse. Okay, just deviate to her first. A lot of times the masseuse is on staff. A lot of times there's an official masseuse down the road. They can do it in her office, but just deviate to the masseuse first. Okay, it's just I feel more comfortable personally. That's just me. And not just gymnasts, soccer players, volleyball players, tennis players, swimmers, divers. Just go to the masseuse first, the professional masseuse that works on staff. Okay? But now, there's 3 guidelines. First of all, okay, Mochiano said this officially the other day. That's why I'm going to say it now. Okay? In fact, every conversation I've had with her has been on her official wall. So any fan can read it. I never talked to her. I never talked to her on the phone. I never talked to her. Well, I mailed her my book. I wrote her a thank you note, but aside from that, that was it. Okay, the thank you note for her signing my book that came in the box with the book was the only private message we ever exchanged. Everything else has been public knowledge, okay? She doesn't do phone calls with fans. She doesn't do emails with fans. She sure as hell doesn't invite fans to the house. But Mochiano said on her official wall the other day that the 3 girls are friends of hers. They came to her and they confided in her, and she encouraged them to report it. Now, she cannot give testimony because she was not there when it happened, but being a coach herself these days, she's a mandated reporter. Being married to a doctor, her husband is a podiatric specialist at St. Vincent's Hospital in Cleveland. Okay, he does foot and ankle injuries, foot ankle rehabilitation, foot and ankle surgery. He is a brilliant scientist. Okay, he's also a mandated reporter. But being in this mindset that she was in, she said, "Okay, you need to go to the police or the governing body, but you need to report that to someone. I can't report it. You gotta report it because I wasn't there. You gotta do it yourself." And that's when it came out. Okay, she did the right thing in my opinion. She didn't witness it herself, but she told the people in question to report it. and let the police come in, let the DA come in, the governing body come in, let the powers that be figure it out. And there's a million different rumors. Most of them are unfounded as of now. We have to wait. But one of the rumors is that Bella and Marta Caroli didn't know what was going on. Another rumor is that Bella and Marta Caroli didn't care what was going on. They just wanted to be done with it. They just wanted their job to get done. They just turned a blind eye to it. That's a rumor. Okay? Bella and Marta, as well as USA Gymnastics, are being sued in court. This individual is on trial for unrelated charges. He may face trial for this, and that's a matter for the courts to decide. Okay? Now, there's three things that I want parents to understand. First and foremost, parents, you have got to tell your child not to allow themselves to be molested. That means if a child is being touched. A long time ago, there was a show on HBO called Families in Crisis, Life Stories. It was half-hour segments of real events, with a little bit of artistic liberty here and there, about real problems that real people faced. In fact, Ben Affleck got his start there. He played a high school football player that was addicted to steroids. And at the end of the show, the real person will come out and talk to you. One of the events was a boy molested by his priest. He was an altar boy. Now, in the Catholic Church, we have confession, where we have a big, giant wooden box that sits on the church's main area. And the priest will go into the center of the box. It's divided in three sections. He'll go into a separate door. There's a door right there in front of you. And it'll be little doors on the side, and the parishioners will go in. And the priest will be in this booth. He'll be separated by a wall with a screen. And the people will tell him my sins, and they will tell penance, okay? And the priest's sins are for the priest alone. The priest can never tell anyone what your sins were ever. Your sins are between yourself and the priest, and that's it. Okay, that's it. He can't tell anyone what happened. Okay, your lawyer and your priest can never be forced to testify against him in court. Ever. The priest would tell the altar boys to have special confession in a private room behind the altar after church. And he would tell them to take off their clothes, stand naked before me like Adam, stand before God, or whatever the hell, blah, blah, blah. He would touch them sometimes, and they would say, I don't like this Father. And he would be like, okay, it's a sin to doubt me. Do penance for doubting Father. The boys would say, well, let's tell him, no. He's a priest. We'll get in trouble if we tell him. We can't tell him. He's a priest. We can't tell him. He's beyond power, whatever the hell. And the man, the real guy, years later came out and he said, because we did not tell anyone, this went on for many years. This is the molestation victim talking, not me. And he said, if an adult touches you in a place that you think is wrong, it is wrong. You must tell your parents. You must tell the police. You must tell an adult when someone touches you. Okay? And once again, using that man's mindset as the victim of molestation, we have a classic case here where the girls did not speak up. He touched their vagina. He said it was a medical treatment. They never asked where his gloves were. Okay? And they never questioned his authority ever. And assuming it's true, this went on for 30 years. If one girl had just said flat out, you know what? Take your hand away. I'm going to tell my mom on you. Okay? This would have been stopped. Because they would have had enough parents to demand the medical board investigate him. They would have had enough parents to demand that the gymnastics team find another doctor. They would have had maybe a chance of indictment. I don't know, but it would have been stopped most likely. Okay. The second thing I'm going to tell you guys is you must be in the room with your child and the doctor. Period. Okay? Now, obviously, if your child is 18 years old, you legally can't be in the room. And if your child is 17, do you want to be in the room? I don't know. But when your child is 8, 9, 10, 11, you must be in the room. I heard a massage therapist, not a doctor, a massage therapist. I was having a conversation. And this massage therapist said, the rules for the kids. If you're under 18, I need a parent signature. If you're under 16, the parent has to witness the entire massage, beginning to end. That means the parent goes in the room with the kid and then the therapist. doors closed, child undresses, towel around the waist, lays down, and the parent witnesses the entire massage from beginning to end. This is a massage, not a doctor's appointment. Okay? And sometimes this therapist says she's had big kids, like they're 15, but they're big kids. And she has literally stood on their backs in front of their mothers. So he's big enough, he can take it, jump right on. Mother sits there and watches the whole thing, doesn't say a word. Okay, fine. But parents have to understand that unless the doctor's saving your child's life, if your child had their leg ripped off and the doctor's stopping the bleeding, if your child is unconscious and the doctor's bringing them back, you got to stay out of it. But unless the doctor is saving your child's life, you have the right to say, you know what, we're going to do something differently. My child has a back problem. You want to do a massage, a vagina massage? Okay, we're going to do something different. We're not going to do a vagina massage. We're going to do a different treatment. Go do a different treatment. Don't do a vagina massage, okay? You have a right to say that. Okay, you have that right. I don't want the doctor to give my child a vagina massage. Okay? You have that right, if not that obligation. Now, I know that sometimes people may be injured in the groin area, especially gymnasts. And I know sometimes that it might be required of the doctor to look in this area because of bruises or injuries or pulled muscles. I understand that, okay? What treatment is the doctor performing? What is the legal medical definition of that treatment? Tell him to write down what he's doing and give it to you for your insurance records, okay? Your child had a groin injury in their vagina, so I prescribed this medication and I examined it and I put, an ointment on it. Okay, fine. Okay, what is going on with my child? What are you doing to my child? Why are you touching him there? Why are you asking him to do? Okay, ask these questions. Parents, ask these questions. Okay, because I guarantee you, most people will not molest a child if the parent is watching them. And don't be afraid to say, listen, I don't want you to do that to my child. Okay, don't touch my child like that. Okay, or I'm gonna go get a second opinion. I'll go to my own personal doctor at home. This is the team's official doctor. I'll go to my own personal doctor at home. Now, sometimes the parent can't be there. Parents work, especially for sports teams that are traveling globally. Parents can't always be there. Is there a proxy? Can the parent even if you gotta get a lawyer and get a contract written, say, I am this child's parent and I cannot be there because I'm at work and the child is traveling outside of the state with their gymnastics team or their volleyball team or whatever. Okay. Who is it going to be? The coach to be in the room with my child during a medical exam. I waive confidentiality. I want the coach in the room. Sometimes you have a male coach and a female athlete, and I don't know about that. But is there a woman coach? A lot of times you have a woman coach or a woman assistant coach or a woman equipment manager or a woman team coordinator or a woman massage therapist on staff. I want that person in the room with my child watching the doctor. Period. Okay? If the doctor says the words vagina or buttocks or breast, or if the doctor decides to unclothe, pick up the phone and call the mother and ask the mother what's going on or tell her what's going on. Okay? Parents have got to know what's going on with their child. That's it. Okay? Don't just let your child go off to the doctor and say, okay, fine. Be in the room or have a proxy in the room for you and ask the damn questions. And the majority of the time, the doctor may very well be a legitimate person that's helping. But you still have a right to ask what methods are being used, why your child is being touched, what medication your child is being given. Okay, you have that right. And I feel like an idiot saying this. I thought everyone knew this. Now, this brings us to the vagina. My personal opinion, only the gynecologist should be examining the vagina. I understand you might have a situation where the team doctor is on hand and the person falls and they have a serious groin injury and there's a big trauma right there, literally in every sense of the word, and the doctor has to help them right then and there. They can't go to the gynecologist because there's not enough time, whatever, they might be bleeding, things happen. But unless it is a critical emergency, only the gynecologist should be looking at the vagina. And you have to tell the parents and the kids what vaginas are. Don't be shy and say, listen, only the gynecologist will look at your vagina. If the regular doctor wants to look, say no, I'll talk to the gynecologist. And the gynecologist looks at the vagina. And once again, parents, where are you when this happens? In the room. Most girls don't go to the gynecologist until they're in their teens, 20, they're usually not 9 years old. But why am I having this conversation? I don't want to blame victims, and I don't want you to walk away thinking I'm blaming victims, but these are simple guidelines that could have stopped this. And me personally, if I were the doctor, I wouldn't want to examine a 9-year-old girl alone. I would say, wait a minute, I got to examine a 9-year-old girl because I'm a doctor. Okay, good. Where's the mother? Tell her to come in and out. Mother's not here? Okay, who's here? The older sister, the coach, the grandmother? Tell them to come in now. Okay? Simple rules, people. Simple rules. Thank you. Goodbye.